Hello, I'm Dr. Daniel Griffin.
And I'm Dixon DePommier.
And today we're going to be discussing Impetigo.
How do you spell that?
Actually, I'm glad you asked. I-M-P-E-T-I-G-O, Impetigo.
Just what is Impetigo?
Now, we have several chapters where we talk about different skin infections. And Impetigo is a very superficial bacterial skin infection.
Cool.
And it is common throughout the world. It is particularly common in children. And it is classically described as a superficial, golden crusted infection. And I think when you think of gold, what organism comes to mind?
Staph aureus.
And it's interesting, and this is very important as we move forward, but we say about 70% of the time these infections are caused by Staph aureus. The next biggest chunk is going to be your strep infections, and then there'll be another, gram-negative rods, other types of bacteria that might come to play.
Now, like some of the other syndromes that we've already covered, why didn't you ask me the golden question?
Where we ask if you had this?
Yes.
Have you had this before?
And in fact, I remember as a child being told that I had impetigo, and I didn't have a clue as to what it was. They said, don't worry about it. We're going to send you to a doctor, and he's going to treat you. But you have to go for multiple treatments.
Okay.
So how do you think I was treated?
Well,
I was treated very well, actually.
You were treated very well? What I worry more about is not how they treated you, but with what was the standard of care back in the day?
This was in semi-rural California near Oakland.
Okay.
I was treated with a series of UV lamp treatments.
Okay.
Which has, of course, as one of its negative side effects, skin cancer. And but as a child, I don't think they had any topical applications that they were specializing in those days. So
now, did you get a nice tan?
I must have. I don't remember, of course, but I think along with it, of course, you got a tan.
Well, this is good. So since you had it, I'm going to ask you if you may not remember this, but what time of the year was it that you got your impetigo?
It was the
summer. And this impetigo is the disease of summer.
Yeah.
It's the disease of lots of children together. You see it in temperate climates. You see it in camps. It is a day camp malady. In tropics, other areas, you just see it. You can actually see year round because it's always moist and very hospitable environment for this. Yeah. Usually, and I think maybe some of us can picture this who've seen it, you see it around the mouth. It looks like these golden crusted scabs, maybe around the nose, around the mouth. Those are the typical places. It can, when it gets bad, it can actually start to spread to the trunk, so the arms, chest, other places. Now, it sometimes gets in the scalp, which can be upsetting as well.
Sure.
So this can be, I think, cosmetically very upsetting to parents. Maybe sometimes more than the children.
Send them to camp, they go in to visit a week later, and everybody's got this golden glow about them that shouldn't be there.
And actually, to children, particularly as they get older, it can be quite upsetting to have this. And so sometimes it can be a delay in diagnosis because they're hiding this. If it's on the face, you'll see it, but if it's on the torso, if it's on the arms, and then you say, let's get you all clean. Oh my gosh, this is all over your body, and it can be quite disseminated. We also say this can be a primary or secondary process. And so diagnosis, it's really critical to know, are you just getting pure impetigo, or is the impetigo a super infection of another primary skin disorder? So it can super infect our friends, the scabies, rashes, the scabies infections. It can super infect our fungal rashes, hopefully.
How about head lice?
It can as well. And actually, I think that's great. A lot of times you're getting mixed infections. Occam was not a doctor. Occam was a medieval philosopher who thought you can only have one thing at a time. And impetigo, I'm going to say the rule is always look to see, do you have two things going on? Because that's going to help in our diagnosis, going to help determine how we're going to treat.
Right.
And so how do you make this diagnosis? We're going to send off some expensive test? Do you have any clue how you were diagnosed? Did someone recognize this?
I think it was a sign. rather than a symptom. They saw me and said, I think that child might have impetigo.
And actually you're right on. This is really a clinical visual diagnosis. You recognize these superficial crusted areas, and then you pretty much can say this is impetigo. You want to carry it a little farther just to ask, is there an underlying process? Is there underlying fungal or scabies or...
Staph aureus is a common inhabitant of skin, yes?
Very, very common.
So why doesn't everybody get it?
So a lot of it has to do with, I'm going to say, hygiene, soap and water.
Hygiene.
And so part of the reason we might see this in camps and in certain areas is where there isn't adequate soap and water, there's an adequate cleansing. So you're ending up with an increase in the bacterial burden. You also may end up with irritated areas of the skin, which then are more susceptible, moist areas of the skin, which, sort of perfect setup.
Yep.
And that actually leads directly into how do we treat this? And so I think you
not with the UV lamp. I don't think they do that anymore.
Not with the UV lamp.
The rate of skin cancer must have been very high among people who have had that treatment from places like Scandinavia and England and Scotland and Ireland. I mean, those people are highly susceptible to skin cancer when they move to the tropics or at higher altitudes. So I think
not a great
outcome to have no impetigo, but
well, I'm going to break our treatment down into two forms of impetigo. We have our localized, uncomplicated impetigo, and then we have our complicated or diffuse impetigo.
All right.
And the first thing I want to say in the localized, uncomplicated impetigo that we see quite often, it's going to make up a majority of cases, there's no clear benefit to systemic antibiotics. So people want to go and they want to grab the pills, they want to take their antibiotics. So I'm going to say, and I think it's sort of one of our pearls, teaching points, things to remember, is that there's no clear benefit to systemic antibiotics in localized, uncomplicated impetigo. And we recommend cleaning with soap and water twice a day. It's technology.
Hygiene.
What is it? The American Society of Tropical Medicine and
Hygiene. That's correct.
Yeah, so we want to think about hygiene here.
That's right.
You can use topical antibacterial creams to the affected areas. Sometimes you'll use something like a mupirocin or a triple antibiotic or a bacitracin. And these, again, are going to be applied 2 or 3 times a day to the affected areas. And then, as we talked about, the issue is when these are moist. And so if you can keep the areas dry, clean, and don't scratch. Easier said than done, because these areas, and particularly in children, the hands want to go there.
Right.
So much like poison ivy, you might have people wear those white gloves just because they'll scratch at night.
Of course.
So you could trim the fingernails this way when the children are sleeping, they're not scratching away. But if we have localized uncomplicated, what do we have?
Well, an easily treated disease.
And what is the opposite of uncomplicated, but?
Well, then you've got complicated underlying mechanisms that might allow this to occur, but that's not the real issue.
So with our complicated, this is the issue where we might get into oral antibiotics. And this is, I'm going to say, important. I want people to think this through. If 70% of the time it's caused by Staph aureus, you want to use antibiotics that work against Staph aureus, or 70% of the time, your antibiotics are not going to be helping you here. Right. So we have a table with a bunch of antibiotic recommendations, and it's the same agents for children and adults. Children, it's going to be weight-based dosing. Adults, it's going to be more standard because, we say this, most adults are roughly the same size, but that is in no way true. And so there are some anti-staphylococcal penicillins like cloxacillin or dicloxacillin that we'll recommend. Cephalexin will work against our sensitive staph, but as we're having more resistant staph or MRSA, that's not going to be working for us. So we move into medicines like Bactrim, that's the trimethoprim sulfa, and we may even occasionally use doxycycline. But we want to use that with caution because in tropical areas where you're getting lots of sun, in the summer, when it's the high point of these, is when you have to worry about the biggest concern with doxycycline, which I'll say is the photosensitivity.
Yep. You have to do a lot of thinking.
Yeah. So this may seem very simple, But this is one of those cases where you have to think it through, because the diagnosis, there's no test to back you up. You're going to have to get it right. And then you have to make sure it isn't secondary to something else. And then you've got to make your distinction when antibiotics are appropriate, when they're not.
Right. So what advice do you give parents that are taking their children to camp for the first time? How do you avoid impetigo?
Well, it is a challenge. And I always feel a little hesitant when you say that, oh, this is something we treat with soap and water, and something that gets worse because of a lack of soap and water, because of lack of hygiene.
Yeah.
Because there's always you always feel like there's a judgment aspect to saying, oh, well, your child got this because they just don't clean themselves enough.
Right.
And it can be very hard when they're outside of the supervision of the adults. But also sometimes it can be transmitted around. There are more aggressive staph and strep, and there might be wet towels. So you may be doing a good job of having your child wash in the morning, wash at the end of the day, but all day while they're out there with a wet face and sharing towels, you can have little epidemics here. And I want to just point, it's nobody's fault. And so that's when even the camp or the facility or whatever setting they need to step in, make sure that they're laundering those towels. You don't want wet bacterial culture towels being shared among them.
Yeah, that's interesting. Very interesting.
Yeah.
Thank you.
Okay. Well, I think that hopefully we've covered most of the, this is a little shorter lecture than many of our others, but I hope we've covered all the important topics.
Great.
Okay. Well, thank you for joining us today.
Yeah, we'll see you again.